just to kind of, you know, so after your introduction, I'm going to say, hey, welcome all again. We are very excited to be here. Yeah.
Hello, hello, hello. Ladies and gentlemen, dental health is a topic that impacts each and every one of us today. And today we're going to take a dive into the fascinating world of dentistry. I'm Trisha, your host for this new and current live show. We have an exciting lineup of discussions with our very own expert and key opinion leader, ready to share his knowledge and insights on the trends, best practices, and affordable treatment options in the field of dentistry. Whether you're a seasoned professional or someone simply interested in maintaining a healthy smile, this show has something for everyone. Throughout our time together, we'll explore a wide range of topics from the importance of oral hygiene, preventative care, to the latest advancements in dental technology and techniques. Well, we have also received several questions from our loyal followers that we'll be answering. We'll also have an interactive Q&A section, and we'll encourage you to send your questions and comments. With no further delay, let me introduce you to our very own dental expert, Dr. Kumar Vadivel, DDS, MS, MBA, FDSRC, is fondly known as Dr. V, who is also a board certified periodontist and a fellow of the Royal College of Surgeons of England and Scotland. Dr. Vadivel specializes in offering dental specialists. Dr. Vadivel specializes in offering periodontal, implant, and oral surgical care to his patients throughout ToothHQ Dental Specialists dental offices located throughout the Dallas-Fort Worth Metroplex in Texas, USA. Dr. Vadivel is also the proud author of his upcoming book, slated for release in 2024. To know more about Dr. V, visit our website at www.mytoothhq.com. So sit back, get ready to embark on a journey into the world of dental excellence. Without further ado, let's kick off this informative and engagement dental live show. Welcome, everyone. It's my honor to welcome Dr. V again, and let's get started.
Thank you very much, ma'am. Thank you very, very much. Welcome all again to another episode of our Dental Dilemmas. And we are very excited to be here. And we actually have a new host this time, Trisha. So we are going to get started. Let's go.
All right.
All right.
All right. So, we have a few questions for you, Dr. V, okay?
Yeah,
So,
absolutely.
our first question says, Hi Tooth HQ, what dental insurance plans do you currently accept? And do you offer any payment or credit plans for dental services?
So the question is, what dental insurances do we accept? And also what kind of payment plans we offer to our patients, right? Not just me as Tooth HQ, and we got people watching it from all over the world or all over the US. So in our office, we accept any PPO plans that you have, or any patient may have PPO, the preferred payment providers from your preferred payment office, the providers. And then if you have any other plans other than the PPOs, like a HMO or like a Medicare, we do offer discounts to those patients. Not just that, and also for patients who do not have any type of insurance or any type of Medicare or Medicaid, we do have a variety of payment options. For example, we call them as a third party financing option. This is one of the companies which we call it as basis for patients who may not have the best credit score. And the other one that we offer is what we call it as a care credit. This is another payment of third party financing option. So the bottom line is, you don't have to worry about, hey, whether do you have dental insurance or what type of dental insurances you have. Give us a call. We are happy to help you at Tooth HQ or wherever you are, and talk to your dental office and see what kind of payment options they have, what kind of dental insurance they accept, and they will be able to help you.
All right. Okay, so good evening, doctor. I have a question about the dental procedure I'm scheduled for. Is it all right to have multiple teeth extracted at the same time? I've been informed that I'll need to have 14 teeth removed, which includes all of my remaining upper teeth because they will be placed on a dental plate.
So the question this follower has is this patient needs to have about 14 teeth removed to have a plate, either a top plate, what we call it as a denture, or the bottom teeth, what we call it as the denture also. Again, this patient, that's what the patient needs. And you know, Tricia, how many teeth we remove at a time. And we have patients, they have all the top 16 teeth going bad and all the bottom 16 teeth going bad. We pretty much put them to sleep and we remove all the top 16 teeth and all the bottom 16 teeth at the same time. So I understand that you may have anxiety, or it may be new to you when somebody is going to tell you 14 teeth to be removed at the same appointment. It's not uncommon. So talk to your dentist and they should be able to help you to understand more whether you can have all 14 teeth removed at the same time. But I can assure you, having 14 teeth removed at the same time, it's not uncommon. We do it all the time in our office, and I'm sure everything should be fine. But talk to your dentist and make sure that you are comfortable doing the procedure. And if you have any anxiety, again, talk to your dentist and they should be able to help you.
Yes.
Is that what we do, Tricia, in our office?
We do it a lot, more often than you would think.
Bingo, bingo, right.
Okay. How much does it cost to get 3 dental implants for the upper front teeth?
So the question is, how much does it cost to get 3 implants for the front teeth, the top front teeth? Um, so the question is, it depends. So first thing that I would say is, if you are going to get just the 3 front teeth alone, whether you're going to really need three implants. Sometimes we don't recommend placing 3 individual implants because sometimes it may end up causing more bone loss than you might think. We don't recommend. So to answer your question on how much does a 3 implant cost, for a single implant, it may range anywhere between about $2,500 up to $4,000, provided you have the right bone. If you do not have the right bone, if you need some kind of a bone reconstruction, for example, if you lost bone due to gum disease, or you lost bone due to like a previous accident or any kind of a trauma, then you may need bone reconstruction. If you do not need any of that, a dental implant alone may cost anywhere between $2,000 and up to a $4,000. That includes the implant and the tooth that you need to put on. So on a ballpark, to reconstruct about 3 teeth with no bone grafting or anything, it may be close to maybe about $7,000 to $10,000 or up to $12,000. Or if you need additional bone grafting, add, give or take, like maybe another about $2,000 to $4,000 up to about $15,000. Would you say it is a ballpark, Tricia?
I will say that sounds about right. I think that's about right.
Perfect.
That's
Okay,
about
let's
right.
move on to the next one.
All right. What is the price of implant supported dentures, and does insurance typically provide coverage for this treatment?
So the next question is, what is the price of an implant supported denture, and does the insurance typically provide coverage for this type of treatment? So I can give you kind of a ballpark fee on how much is that going to cost to provide to get a denture, implant supported denture. This is what we call it as an implant supported denture. So what it is when you have lost a complete set of teeth, this is what a denture is going to look like. There is nothing holding. We call it as a grandma denture, and typically you might have seen your grandma wearing something like this, but a lot of times when they are having difficulty in wearing that, because it's almost like a flip-flop and it does not want to stay in your mouth. And a lot of times you are going to see the grandma keeping this in a bottle, or like in a cup or in a bowl, and that's why we recommend you get what we call it as an implant denture. So as opposed to like a regular denture, which does not have any security, what we recommend is you get implants, So see here, this is, and again, a denture, but it does have implant. So it is going to have implants to secure your denture, and you can possibly hear the clicking noise here, and you cannot, this is not going to be like a flip-flop as opposed to this. If I'm going to let this go, see, this is going to drop, but with an implant denture it is just holding it in place. So to going back to your question on the cost of that, depending on whether you're going to need, I don't know how well you can see, um, whether you're going to need 2 implants or 4 implants to hold the denture. It may cost anywhere upwards to $10,000 all the way up to maybe about $15,000 to $17,000. And to answer your second part of the question, whether the insurance is going to pay for that or not, that actually depends on the plan that you have. For example, a patient who has MetLife and the same patient, another patient who has MetLife, they may not have the same type of coverage. It depends on what the employer has chosen for them, uh, the coverage. So the answer is, either if you are in the Dallas-Fort Worth area, call us and we will be happy to check the coverage for you, or wherever you are, and talk to your dentist, and they should be able to check the coverage and let you know whether you have coverage for this dental implant or not. Tricia, isn't that what you do every day?
Every
Tell them,
day.
what do you do? How do you call to check coverage?
I call the insurances and I ask questions.
And ask them for a specific code on whether the implant is covered or not, right?
Specific codes, yes, specific treatments, and they all different. It all just depends on which insurance you have and what your plan has.
Okay, perfect. Okay.
Okay. Could you please provide me with the information or assistance regarding the process of acquiring partial dentures?
So the question is, can I provide information on how to acquire or how to get partial dentures? First, I want you guys to know a partial denture, meaning I showed a denture earlier, which is like a complete set of teeth. This is what we call it as a complete denture. So what a partial denture means is, if you have, for example, if you have lost a front tooth, this one has one single tooth. If you have lost some set of teeth, like maybe 3 or 4 teeth, instead of having one tooth, this is going to have a set of teeth, maybe 3 or 4 teeth in the front. So the process of that is whether you're going to lose the teeth and you need a partial denture immediately, or you already lost some teeth and now you got some missing teeth and we need to make a partial denture. The procedure, the process is going to differ. So no matter what it is, whether you are going to miss some teeth or you already have missing teeth, you know what we do, Tricia?
Yeah.
So tell them what we do. We take impression. Tell
We'll
them.
take an impression. From there, we'll send it to a lab, and we can get you in for, if you only have one missing tooth, the denture will come back with one tooth. If you need a whole front, the denture will come back with the whole 4, 5, 6 front teeth.
So the bottom line is, let's say, we the dental offices, we call them mold or impressions, right? So the bottom line is, when you come into our office at ToothHQ, or when you go to any dental offices, we are going to take an impression, which is a mold, and which is going to duplicate how many missing teeth that you have, and that's just going to come out like a mold like this, and then the lab makes the teeth on those mold right here like this, and when you come in, we are going to take it out of the mold, and this is a duplicate of your mouth, and we are going to fit it in your mouth. And tell them, like, what is the turnaround in our offices? We do it like as soon as like a day.
Yeah, we can get them done in like a day, 2 days. They come back real fast.
Yeah, and then talk to and depending on how urgent it is, what if you have to go to an event, or you are getting married next week or the week after. So make sure that you are going to communicate with your dentist or with us when you're here how soon you need it. Depending on that, we can make them as soon as maybe the next day.
Yeah.
Perfect. All right, let's go to the next one.
Okay.
Number
Number six.
Yeah.
Is bone grafting necessary following the removal of wisdom teeth, or would an implant be a suitable alternative?
So the question is, would a bone grafting be necessary following a removal of a wisdom tooth? And then the second question, part of the question is, would an implant an alternative to for the wisdom teeth removal after you remove the wisdom teeth? First thing, I'm going to answer the second part of the question, which is we do not replace the wisdom teeth. So we want to get rid of them because these are hard teeth to keep in the back and you can't keep them clean. Whenever we remove the wisdom teeth, we do not recommend you replace with an implant. So if somebody is telling you that, hey, you really need to replace a wisdom tooth when you have a second molar, ask them whether it is really necessary or not. And the first part of the question is, do you need a bone grafting following a wisdom tooth removal? Most of the time, we do not recommend you get a bone grafting following a wisdom tooth removal. I would say probably like 80% of the time. However, 20% of the time, we might recommend a bone grafting following a wisdom tooth removal because one of the goals for the removing the wisdom tooth is we want to prevent any further bone damage to the tooth in the front of the wisdom tooth. What if you already had severe bone damage to the tooth in the front because you left your wisdom tooth longer and you did not remove it early at your early age on time? So at that point, we are going to recommend you get a bone grafting to preserve the health of the tooth in the front, which is the one that you really want to keep. So, to answer your question, do you really need bone grafting? That really depends on the condition of the tooth in the front. And the second part of the question, do you really need an implant when you remove a wisdom tooth? You do not.
No.
Does it answer the question, Tricia?
That answered the question spot on.
Perfect. Okay.
Okay, number seven. What information can you provide about group dental insurance plans and its benefits?
So, the question here is, what are the benefits of a group dental plan and what are the benefits? Um, so one of the key benefits, and this question gets asked a lot, and so several of the patients, one thing I want you guys to know about majority of the patients in the United States say they do not have dental benefits. More than 50% of the people, or maybe even more. I need to look up the statistics on that. So when they do not have dental benefits and dental treatments sometimes could be expensive, most of the patient when they don't have dental benefit, they're going to come in, they're going to ask us, oh, can I get a dental plan or can you recommend a dental plan? I can go get the plan to come back and get the treatment done. First thing is when you are not employed and when you're not going to go through an employer, the benefit that you're going to get is completely different than the one that you're going to get through an employer. Because what happens is when you go through an employer, and particularly depending on the size of the employer too, so they probably negotiated the best benefits for you because they want you to work for them, right? So you may have great benefits when you work for one employer as opposed to another one. For example, we get a lot of governmental plans, which are the federal government plan. People working for USPS, some of them come with great benefits. Some of the plan that we see, people who work for UPS, where they got fantastic benefit. At the same time, we see plans and they work for like a great Fortune 500 company. They don't have the best benefit. So the question is, it really depends. So the as opposed to like a private plan that you're going to buy is going to be completely different than a group plan. And that the benefits of the group plan is because the employer has negotiated the benefits for you, and that's why it is going to have better benefits as compared to a private plan. If you are going to get a private plan, make sure that you are going to understand the benefits and and understand the premium and whether you are going to be able to pay a better premium to get better benefits, and also the waiting period and the coverage. So those are the two other things, and the waiting period and what type of coverages that you are going to have. That is going to be another big impact on whether you should really be getting a group coverage or not. And so that answers your questions on how good are the group plans and what are the benefits the group plans have.
Mm-hmm. All right, number 8. What factors should I consider, and what are the potential implications of undergoing molar extractions as part of my dental treatment plan?
Um, so what this follower is asking is what are the potential implications of undergoing a molar extraction as a part of my dental treatment plan. So getting a molar tooth removed, it is not a potential implication as a part of your dental treatment plan. If that is what you're going to need, you need to have a molar extracted as a part of the dental treatment plan. I am going to recommend that you need to have that molar removed. So there is no implication on that. The only thing is, you need to understand the consequences of it, the benefits of it, and the risk of it, and how are you going to replace those teeth. So my recommendation is, if you have to end up losing a molar, it is not a problem, but you need to understand the risk and the complications of either replacing them or not replacing them. And then also, one when you are going to end up losing those teeth, what are the benefits and risk of not replacing them also. For example, a molar tooth can end up causing some you are going to end up losing a lot of bone in the sinus cavity if you are going to end up not replacing them, so you need to replace them. So on the bottom jaw you're going to end up losing a lot of bone, so you need to understand how it is going to impact. So for example, a tooth like this, when you have a tooth like this, and the tooth is going to stay and it is going to retain the bone. When you start losing the bone is going to go all the way down like this. So you don't want to end up losing the bone. So if you end up removing it, of course you're going to have some risk, but at the same time, if you do not replace that, you are going to have some risk also. So understand the risk and benefits of keeping them, not keeping them, by losing them, but also at the same time not replacing them as well.
Okay. Number 9. What is the estimated cost for replacing all missing upper teeth with dental prosthetics or implants, taking into account factors such as material, procedures, and any additional treatments required?
Um, So what this follower is asking is, what is the estimated cost of replacing the upper teeth? And I'm assuming they are talking about replacing all upper teeth. And how does the cost play, or what is the difference in cost depending on the prosthetics, depending on whether they are going to need implants, or even when they are going to get implants, and depending on what material they are going to have for teeth replacement, such as it is going to be made of plastic or some other hard material, or whether any other additional treatments required. So the first thing is, if you are going to need just the teeth extracted and implants to and get a regular prosthesis like a denture, you are not going to incur a lot of costs. So remove the teeth and be done with it in a regular denture. This is going to be the least expensive option. If you are going to have teeth extracted, but then you are going to need some kind of a bone grafting, either to get a denture or to get implants, then that is going to be an additional cost on the bone graft. And after you get the teeth extracted and you want to have implants, depending on whether on the implants, whether you are going to have a removable teeth or you are going to have completely fixed teeth like this, they don't come out. The cost of that is going to differ. And now let's say whether you're going to have a completely fixed teeth. If you are going to have something like this plastic, which still doesn't come out, and it's just going to have sitting on the top of those teeth as a fixed teeth, that is going to be a slightly less expensive as opposed to what we call it as a zirconium teeth that are going to completely be as hard as a rock like this. And if you're going to have zirconium teeth on there, then the cost of this is going to differ. So what we normally recommend is talk to your dentist, and then when patients are asking, when they come to our office, and we normally say, hey, this starts from possibly like about $7,000 and up for about $3,000 to $5,000 or up to $7,000. You can get a regular denture, or up to it goes to about $25,000 to $30,000 per set of teeth, which will be a complete fixed implant and a complete fixed teeth with made of porcelain, or like what we call it as zirconium. So the question answer to your question is, it starts at maybe about $3,000 to $5,000. It goes up to about $25,000 to $30,000 for a complete set of teeth, either the top or the bottom.
Okay. Would it be more advisable to undergo a root canal procedure or to have a tooth extracted and replaced with an implant?
So the question is, would it be advisable to do a root canal or remove the tooth and be done with it and replace it with a dental implant? So as a dentist and as a dental specialist, I'm here to give options to my patient. We do not do any treatment without giving them options to the patient. So if you have a smaller cavity that requires a root canal, and my recommendation would be that to strongly consider doing a root canal treatment. That's going to be the least expensive option. And I'm not going to say just for a smaller cavity, oh, remove the tooth and be done with it, as opposed to on the same on a patient. Let's say that a patient had some complications on the previous root canal they may have had, or they had a previous root canal that failed within like 2 months after. They're going to say that, hey, even though it is a smaller cavity which is going to require a root canal, they're going to say, hey, I don't believe in root canal, and I don't want to do this, and I want to get the tooth and done with, or I don't have the money to do the root canal then, and we don't have an option to do other than removing the tooth. However, having said that, removing the tooth just because you need a root canal and replace it with a dental implant, I do not recommend that. You evaluate your options and you understand the risk and complications and the pros and cons of removing the tooth and do an implant as opposed to doing a root canal. And then your dentist will be the best person to address that. For example, whether it is a first time root canal or whether it is a second time root canal, whether you have the right bone, whether you do have an abscess, which is along with a root canal you're going to require. So there are multiple factors which are going to help you decide whether it is just a simple root canal or you're going to need extensive treatment after this root canal tooth to be removed to replace a tooth. So your dentist will be the best option, and if you happen to be in the Dallas-Fort Worth area, come see us, and we are happy to help you. Absolutely, yeah.
Okay. All right, so your next question is, does ToothHQ offer financial assistance or funding options for general and cosmetic dental treatments?
So the question is, does ToothHQ offer financial assistance or funding options for general or cosmetic dental treatment? Um, we do not offer financial assistance, meaning like if you are thinking about not being able to pay or afford the treatment and whether we can do the treatment for free, we do not offer those kind of options at ToothHQ. However, we'll be happy to see you for a free consultation, and offer the variety of treatment options that we offer in our office. For example, care credit is one of the most common treatment financial options, or basis is another option that we have when patients do not have or they don't have the best credit. We offer another the treatment option called the financial option called basis. So if we are not able to offer, we are going to find the right place. For example, you really can't afford for the treatment. We do have some nonprofit clinics we work with. We can send you to, or we can find in Dallas. One of the most common places is patients are being sent to Parkland Hospital when they cannot afford for dental treatment at all. And in Dallas again, we have a great dental institution, a dental school. So you can go stand in the line to get the tooth removed or dental treatment done. But in our office, we do offer variety of payment options, and we work with a variety of banks that they're able to not just one. We got two, three, four options, and depending on your credit, we will be able to talk to the bank and then able to offer a variety of financing options. Or if you're looking for financial assistance, we can send you to places that you are able to get some kind of a financial assistance.
Mm-hmm. Yes, sir. All right, so we have hit our halfway mark. At this time, we'll do a new segment that we have called Quick Answer Segment. In this segment, I'll ask Dr. Vadivel a couple questions, and he'll give me a quick answer, just like that. You ready?
Yeah.
All right. Number one, are electric toothbrushes better than manual toothbrushes?
So the question is, are electric toothbrushes better than the manual toothbrushes? Absolutely yes, and I can quote a variety of studies, and they were able to prove that the electric toothbrushes are slightly better than controlling the bleeding and the gingivitis. And personally, I use this as an electric toothbrush, and I'm going to say that electric toothbrushes are definitely slightly better than the manual toothbrushes.
I agree. Number two, what is the most common dental issue among the adult population of Texas?
So the question is, what is the most common dental issue among the adult population in Texas? And I'm going to twist the question and then say, what is the most common dental disease in the United States, or what is the most common dental disease in the world? Most common dental disease, half of the adult population in the US have periodontal disease or the gum disease. Or if you look at the world, like maybe about 60 to 70% of the population have periodontal disease or gum disease. And the second most common disease, 25% of the adult population in the United States have cavities or dental caries, or about 40 to 50% of the population in the entire world have the dental caries or the dental cavities.
In the world.
In the world.
Not
Did you
just,
know that?
Not just Texas.
Not just Texas, man. Yes.
All right. Can you identify a frequent error people often make in their oral hygiene routine?
So I can pick variety of them, and because you said it's a rapid fire round, like a quick question, so I'm going to take to maybe say top three. So the top three things that people make in their dental oral hygiene is they do not brush for enough time. So the average American, they brush for about 30 to 45 seconds, whereas the average should be about 2 minutes. I see usually pick a quadrant like 30 seconds each, 2 minutes you got to brush. And you got to brush twice a day. They do not. They brush once a day. They are supposed to floss at least once a day. They do not floss. And they are supposed to brush the inside of the teeth as well as the outside. They do not. And so these are the most common errors. And so brush twice a day, floss at least once a day, at least brush for 2 minutes. And these are the most common things.
Okay. All right. Do brown teeth necessarily indicate poor oral health?
So the question is, do brown teeth necessarily indicate poor oral health? It does not. So brown teeth could be due to like a variety of reasons, as simple as you grew up in a place where they did not have enough fluoride. So we do like a lot of ethnic, we see a lot of ethnic patients here. They come from different parts of the world, and some of them got brown teeth. In the place they grew up, they did not have enough fluoride in their water, and that's why their teeth kind of brown, they look brown. Or maybe during their adolescent period, they had to probably take some medications for their acne or other antibiotic, and that made their teeth look brown. So brown teeth does not necessarily mean that you have poor oral health. It could be to a different reason, and as long as you maintain it, you can have brown teeth for the rest of your life. You are still able to maintain them healthy.
Okay. Okay. Last question for the quick answer segment. You ready for it?
You got it, man.
All right. What is the primary indication of one early signal of gum disease?
So the question is, what is the one of the primary indication for an early sign or early signal of gum disease? The most common thing that you are able to notice, you don't have to be a doctor, you don't have to come to me, don't waste your time, come to see me, or don't waste your money to come see us or any dentist. The most common sign or the signal is the bleeding from the gum, bleeding, pain, and swelling and loose teeth. These are the most common signs of gum disease, and bad breath also. So if you are seeing any of that, bleeding, swelling, bad breath, and loose teeth, immediately that is a sign or the signal of the gum disease. Yeah?
Boom.
You got it?
You made it through a quick answer segment.
Thank you. Thank you.
All right. All right, so back to our questions.
Thank you for the compliment, ma'am.
You're welcome.
Yeah.
I specialize in compliments.
Thank you.
Okay. I have a question. Question that says, "Thank you for the video. Numbness and pain, troubles afterwards."
Looks like we have some live questions here. So do you want to address them first
Yeah.
Yeah.
Okay. All right. I see one. It says,
Actually, three questions that we have. Three live questions we have.
Okay.
Why don't we address them first?
Okay. All right. So I see, "Hello, Dr. V. With my recent dental implant procedure and existing gum disease, is there a risk that my implants could be damaged as a result of the gum disease?"
So the question here is, this follower has a recent dental implant, from existing gum disease. Is there a risk that gum disease could be causing to the implant from the existing gum disease? So first thing, as you guys might know, we are a gum specialist office, and we are periodontists, and that's what we primarily do. So if you had existing gum disease, more than likely your dentist, you already addressed the gum disease prior to placing the dental implant. Depending on the amount of gum disease and you may have, the patients in our office, and if you have mild gum disease, and we may treat the gum disease and place the implants at the same time. If you have moderate to advanced gum disease, we are going to address the gum disease first, either by doing deep gum therapy or laser assisted deep gum therapy or laser gum surgery or conventional gum surgery. And we want the infection from the gum disease to be completely controlled before we give you the dental implant, because the last thing we want to do is you invest in getting the dental implants. Now the existing gum disease is going to destroy your investment. You don't want that to happen. So I would rather inform you that your dental implant is going to get delayed, because we want to get the gum disease under control, and any dentist would want to do that. And imagine if you have termite all over your house and you don't want to go invest in constructing your room or putting in new furniture, so you want to control the termite first. So same thing, implant is a reconstruction of your mouth, but you don't want to have any type of infection from the gum disease, which is going to ruin your your construction, right? Reconstruction. So control the gum disease first before you get any type of dental implant. That's what we do all day long. Isn't that, Tricia?
That's true. That's what we do.
Yeah.
Okay. I see another question that says, is laser treatment approved by the American Dental Association, the ADA?
So what the follower is asking is the laser treatment approved by the American Dental Association? So anytime we do the laser, we do laser with expensive laser machines, and in our office, we got two types of dental machines, and one of them cost about $70,000, and the other one cost like about $100,000, and that's what the laser machine that we use to treat the gum disease. These laser machines are approved by the FDA, the the Food and Drug Administration. So that's a federal agency. The Food and Drug Administration is the one who approves the laser machines to be sold in the United States to treat the gum disease. However, the American Dental Association does not does not put a seal of acceptance. For example, if you go buy a toothpaste and that is going to have an ADA seal, and that means American Dental Association has approved that. So as far as the laser, we don't have a seal that says approved by the American Dental Association. However, that doesn't mean that you need to have an ADA seal for us to be doing. And we do everything in our office, and we call it as a research or evidence-based dentistry. So as far as the evidence-based dentistry, laser is evidence-based. We do the laser based on the evidence that laser is able to help you to treat the dental disease or the gum disease, and it is FDA approved. So it is a safe procedure to be doing, although you may not seal or directly see the ADA seal of acceptance. Does it make sense, Tricia, what I'm saying here?
Yeah, I understand what you're saying.
Yeah.
Another question I see. I'm a 57-year-old male dealing with sleep apnea. What are the different types of oral appliances available for treating this? And which one offers the best balance of cost and effectiveness?
So what this follower is asking is, this follower is suffering from sleep apnea, and there is some, whatever the reason may be, they are thinking about doing some type of oral appliances or dental appliances to treat the dental sleep apnea. So there are two common appliances that are available. These are called oral devices or dental devices to treat sleep apnea. So the two common ones are the jaw positioning. What that means is, if you have a dental sleep apnea, one of the reasons why you are not able to breathe better is because your jaw is not positioned properly. It falls back, your tongue falls back. So what we normally do is a jaw forwarding device, and so which means that the device that you're going to place is going to bring your jaw forward like this. So when it brings your jaw forward like this, it is going to open up your airway. Now you're able to sleep, you're able to breathe better. The other one is to help you reposition the tongue. So it is a tongue repositioning device. What is that going to do is, anytime you're not able to breathe, your tongue is going to fall back, meaning like it is going to fall back and then close your airway, that you're not able to breathe, you're suffocating. So what we now, what we do when we do the IV sedation, tell them what we do.
Sometimes we have to hold the tongue out to get oxygen in the body.
Yeah, we stick your tongue out. So we pull the tongue out like this. When they are IV sedated, they can't breathe. So we pull actually the tongue, and we will start to see the oxygen saturation coming up, right? Mm-hmm. So that's what we do. So the other device is going to do is actually going to position your tongue forward. So now your airway is going to open up and you're able to breathe better. So to answer your question, the two common devices are the jaw repositioning device, and the other one is
the pulling the tongue out.
The tongue repositioning device. Okay, got it?
Yes. There's no more questions.
No, I think we got it. Like,
We
I
got
think
them
those
all.
are three questions.
All
So
right.
so let's move on to our next question then here.
Okay. All right. So the next question it says, "Thank you for the video. Numbness and pain, troubles after wisdom teeth surgery, Dr. Vadivel. At 58 years old, I've been experiencing wisdom teeth pain for several months now. Recently, it worsened, prompting me to visit the dentist last week. After examining me, the dentist prescribed antibiotics and scheduled an extraction appointment for this Saturday. However, upon reviewing the X-ray, I noticed the nerve is located near the tooth, which has left me feeling quite anxious. Should I consider suggesting a cornectomy as an alternative option?"
Well, first of all, thank you for being a loyal follower and watching our video. So, what this follower is asking is she's 58 years old and she needs to have a wisdom tooth removed. And after watching our videos, and which explains the complications of removing wisdom teeth when you get older, she's a bit anxious about removing the wisdom teeth because it is getting closer. It is sitting or located closer to the nerve. So what the caller is asking is whether should she consider a coronectomy as an alternative to completely removing her tooth. So what that means is, so whenever you have a tooth, imagine this is the crown of the tooth and this is the root of the tooth. And imagine this is sitting close to the nerve, right? So, or sometimes what we call it as a traversing through the nerve. So what that means is the nerve is sitting here and the tooth is actually going all the way into the nerve. So when it is doing that, and whenever we do procedures as surgeons, we want to avoid risk and complications as much as possible. We don't want to go and remove the tooth just for the sake of removing it and end up having to create complications. And it's like, waking up a sleeping dog. We don't want to do that. So we want to prevent any complications. In those cases, what we normally do is if the tooth is traversing through the nerve, so we don't remove all the way the whole tooth. So we end up actually sectioning the tooth right up here. And what the caller is asking is coronectomy. So if this is a crown of the tooth, we just remove the crown, or maybe just a little bit of the tooth, little bit of the root, and we leave the rest of them inside. So particularly in older patients, anytime patients are about 35 years or older, we normally are very, very cautious about removing the wisdom teeth. Unless it is really absolutely necessary, we do not recommend removing those when patients are particularly older than 35. So if you are a 58-year-old a person, and if a tooth is traversing through the nerve, then my recommendation would be to consider the coronectomy, and again talk to your dentist. And if your dentist is comfortable doing that, then just get it done through a dentist, or come to a surgical place like us, and or go to see an oral surgeon or a periodontal surgeon who specializes in removing those type of teeth which are particularly sitting close to the nerve. And they may be able to say, if it is not completely traversing through the nerve canal, they may say that, hey, it is safe for you to remove, although it is closer to the nerve. In that case, I would recommend completely removing the tooth. But if it is traversing through the nerve, which means a part of that tooth is going through the nerve, then absolutely coronectomy, which is removing just the top part of the tooth, which is the crown, is absolutely, I would say, the best option. Again, your dentist or your oral surgeon or a periodontal surgeon should be in a best position to answer that question. Guess what? In our office, and we do CT scans, and all the time the CBCT scans we call them. Those scans are three-dimensional diagnostic aids, and we should be able to see how close the tooth is sitting to the nerve, or whether it is traversing through the nerve or not. We should be able to see that on the CT scan.
Mm-hmm. What is the likelihood of experiencing nerve damage after the removal of wisdom teeth? What are its consequences?
So what this follower is asking is, what is the likelihood of damage to the nerve after the wisdom tooth? and what are the consequences. So the chances of you incurring any type of nerve damage is, anywhere up to 10% or maybe even slightly more, depending on the operator and the experience and your situation. Um, so anytime, again, talk to your dentist or your surgeon or your periodontist to see what is your risk percentage, or what are the what is your what are whether you are a high risk patient or you're a low risk patient. That depends on how close the wisdom tooth is sitting to the nerve, what is your age, and whether you have any other type of medical complication. All of those things do matter. So I can't really tell you, like, a throw in a percentage and tell you what is the percentage. And then the second part of your question is, what are the consequences of having a nerve damage from the wisdom tooth? So there are two types of complication. No, the nerve damages can happen. One, you're going to lose sensation to the lip or the chin following the procedure, or the second, you may end up having loss of sensation to the tongue, whichever side you are going to have the tooth removed. For example, if you are going to have a tooth removed on the right side, you may lose a sensation to your tongue, half of your tongue, or half of your chin or the lip, or to the side where you're going to have the tooth removed from. A lot of times patients tend to think that they are going to lose function. So people, I always, or a lot of times patients here say, oh, is my half of my face going to be paralyzed from removing the wisdom tooth? No, because the what we call it as a motor nerve, the functional nerve, is not going to be affected uh, most of the time, or any time at all, I would say, by removing a wisdom tooth. Only the sensations are going to be affected, which are going to be to your tongue or the chin or the lip. Again, talk to your dentist or the surgeon or your periodontist, and they should be able to tell you what kind of a risk you may face, or what may be the consequences.
Yeah, that can be scary.
It could be scary, but it is, a lot of times it is treatable. And again, I've been practicing for the last about 30 years, and I've had quite a few instances. Patients had some type of nerve damage, and a lot of times, we see them recover, like, all
Yeah.
all the time.
Yeah.
The numbness comes back, and very rare occasions, and we know that we explain to the patient they are going to have some kind of a nerve damage. And then if that happens, and then there are several means to handle that, by sending them to, like, a neurophysician or a microneurosurgeons. And if you happen to be in the Dallas Fort Worth area, come see us and we can definitely help you.
Okay. Hello, doctor. Next week, I'll be undergoing a wisdom tooth extraction. Since it's positioned near a nerve, I'm aware of the risk from the other videos. If the nerve sustains damage during the procedure, will it eventually heal, or is it lost permanent?
So, um, again, thank you for being a loyal follower. And so, what this loyal follower is asking is, the person is undergoing wisdom tooth extraction, and the tooth is positioned near a nerve, and they are aware of the risk of the nerve damage by watching some of our other videos. And what they are asking is, if the nerve has to sustain any type of damage during the wisdom tooth procedure, whether it is going to heal or the loss is going to be permanent, right? So the question is, the first part of the question is whether it is going to heal. So doing this for the last about 30 years, how many patients do I have with the permanent nerve damage? Very, very few. So a lot of times, and you are going to have some type of nerve damage, which is, a lot of times, it is temporary. What that means is, we are going to have a period of time. The patient will not have any type of sensation to the chin or the lip or even to the tongue. So this temporary period could be like a week, or like a few weeks, or it could be like a few months. And if it goes beyond months, and that's when that's when like the damage could be sometime become permanent. Although I have seen patients have waited for like quite a few months and they still got the sensations back. So, to answer your question, if you have a temporary loss of sensation, which is coming back and it is going to completely heal, and it may be you are going to get all the sensations back, and a lot of times, what we do is like whenever patients are going to lose the sensation to the tongue or the lip, we are going to put them on a very close monitoring. We are going to see them. We are going to put them on medication such as steroid for like a period of time. We are going to put them on vitamin B, which is going to help regenerate the bone, and we are also going to give them some physio, like massaging your lip, or like keep tapping the lip, or like massaging your lip and all of that. So those are going to help you regenerate, or help these the lip or the tongue talk to your brain. So by doing those, and then that's going to help, and the medications are going to help get their sensation back quickly also. And if that happens, great. And you waited for like about 6 weeks or a couple of months, and if the sensation came back, that's great. If they do not come back, then at that point we have to start thinking about like, hey, are the sensations are going to come back? And one of the most common questions that I ask my patients is, hey, how close is it normal to you? And is that something that you can live with for the rest of your life? And let's say sometime patient say that, hey, I'm 80% close to normal or 90% close to normal, and I think I can live with it, and I'm almost used to that, and they don't want to go see a neurophysician or a neurosurgeon for further treatment. So we tell them, okay, fine, you can live with it and you're fine. But if a patient says that, hey, it feels like only 50% normal, I definitely want to explore options. In that point, we are going to tell them to go see either a neurophysician, whether they can do a variety of investigations, including prescribing more nerve medications to make the things better, or sometimes we send them to who we call it as a microneurosurgeon, and the microneurosurgeons are going to do a variety of investigations, including some MRI scans and other investigations to see whether they are a good candidate for surgical nerve repair.
I think we covered a lot of the nerve damage questions.
Absolutely, yes. Yeah, tonight there seem to be like a lot of questions related to nerve damage.
Which are good questions. These are good questions.
Awesome.
All right. I need implants for upper and lower teeth. Does ToothHQ offer dental implants? If so, do you accept insurance for this procedure?
Great question. So the question is, I need dental implants for upper and lower teeth, and in ToothHQ, do we offer dental implants? And if so, do we accept insurance for this procedure? Great question. If you happen to be in the Dallas-Fort Worth area, which sounds like, and we definitely offer dental implants, and I always say this to my patients: this is all we do, and we do it well. And we are the dental specialists, and we do the implants all day long. So if you are needing implants for the top, we do it. If you are needing implants for the bottom, we do it. If we need implants for the top and the bottom, we do it. We can do them all at the same time. We say a lot of times in the same day dental implant, which means our same day teeth. And if you happen to have needing dental implants for the top and the bottom, and we put you to sleep, we put the implants up on the top, we put the implants up at the bottom. Before starting the procedure, we could have already made the teeth for you, and depending on what type of implants you're going to need, either we are going to give you like a denture like this following the implant procedure, or if you're opting for sometime what we call it as an all-on-4 or all-on-6, we are going to place the implant, and then we are going to put the temporary teeth. And a lot of times these are screwed in temporaries. We are going to put the teeth and we are going to screw in those temporaries at the same time. So you are going to walk out with teeth that are not going to come out. They are going to be completely fixed in your mouth. Eventually, these will be transformed into final teeth, and whenever we are going to replace them with the final teeth. And then, do we accept insurance in our office? Absolutely, we do. So talk to our office and call the office, make an appointment. We are going to see you for a free consult, and we are going to let you know what type of insurance coverage you have, benefits you have, and we are going to take it from there. And if you not happen to be in the Dallas Fort Worth area, talk to your dentist, and then they should be able to help you. And I think we are coming to the end of our show. And again, thank you again for another great episode and great questions. And we ask you to follow us on the channel, subscribe to our channel, and we would love to have you guys and see you on the next show. Until next time, you guys take care. Thank you so
Bye.
much. Bye, y'all.
Vadivel, you said it wrong. You were supposed to say, if you're not in the Dallas area, always stop.